Let me just make sure Charlie. That's good. Then you might do 15 minutes. Okay. Okay, everybody, welcome back again today. Hope everybody had a good night of digesting all the wonderful talks and content that we had yesterday. And today we're going to have more very good talks. And this morning, it's going to be focused on measurement. And we're going to have some really good speakers for that. We will be keeping to time today so that we have good audience participation, because we really appreciate having folks come to our meeting. And I'm going to turn it over to Hiro, and you all have your agendas. We're going to repeat this after this, but there will be a half-hour break today to continue networking and discussing and asking some of the panelists questions at that point. And then there is also an hour-and-a-half networking luncheon for all participants, except for there will be a lunch for everybody, and then there will be a continued networking session for all the participants, except for the forum members who will have to go into closed session for 2 hours during that networking session. But then we're all going to come back for an ideas camp that IBM is running, where we'll be generating ideas for solutions to the refugee crisis in Europe. And in early 2016, they will then bring developers together, and they will be developing some technological applications based on the content that we generate. So it's really important that we have full participation at the Ideas Camp this afternoon. Okay, so it's a little bit of a roadmap today, and again, we'll revisit that. But first, I would like to turn this over to Hiro, who's going to be moderating this discussion. And Hiro, once again, is the Courtney Sal Ross University Professor of Globalization and Education at New York University, and he's a member of the Forum.
Thanks, Kimber. Measurement has come up multiple times during our forum meetings, but I think we're delighted to have a whole morning on measurement. I can see the enthusiasm in all your faces. I'm going to go very quickly through some introductory remarks about two themes. First of all, the idea of measuring contexts versus individual capacities. And then second, a tension between culturally grounded measurement versus regionally or globally comparable, or even nationally comparable, given how diverse countries are. So turning to the first theme, the idea of context versus individual capacities, we have a vast array of contexts that are implicated in ECD programs and policies, including, of course, the measure of the quality of learning environments, family interactions, measures of the quality of training, pre- and in-service, implementation quality. We can think about systems quality that includes community, governance, and policy factors, but we also have an array of individual capacities, strengths, and needs. And I think our tendency is to go first towards kids, but I just did want to point out that we have children's development, of course, at the core of ECD, but also parents' capacities, staff capacities, and competencies. And for each, we can think of different kinds of measures that include screening, summative assessment kinds of measures, and formative assessment kinds of measures. And so we are simply not going to get to the full array of what would be a comprehensive measurement agenda in ECD. We'll cover, I think, some intriguing snapshots of those, certainly with a priority on on child development and learning, but also on the quality of their immediate environments. Then I think Kofi mentioned this in our kind of forum-only meeting that introduced, that was 2 days ago. And this was the importance of culturally grounded and appropriate measures that are sensitive to cultural variation within a country. But there is also been a call, and of course the Sustainable Development Goals are the latest example of this, for nationally, regionally, and globally comparable measures. And I include regionally here because we do have some regional examples currently in the ECD field, like the East Asia Pacific Early Childhood Development Scales developed by Nirmala Rao and her colleagues. We have a wonderful set of speakers. Abby Rakes is going to give a keynote, and then we are going to have several examples of measures of early childhood development, which we're very excited to have as part of this morning before the break. And then we're going to have a response from Emily Vargas-Barón, who's had decades of experience in terms of helping countries improve their ECD systems, and in a very important part of that being around measurement. Before introducing Abby, I'm going to just say a little bit about her. She has been a leader in the ECD field, both in the US, but really for the main part of her career globally, and has been a faculty member at UC Davis and now at the University of Nebraska, but has worked at the Gates Foundation, at UNESCO, and now at UNICEF in leadership roles. And just to give a context, UNESCO and UNICEF are the two lead UN agencies around the Sustainable Development Goal in ECD. But we can't blame Abby for any of the shortcomings of the SDG language. She has done everything to negotiate, I think what Gillian was talking about is this extraordinarily complicated, could not be more complicated, political process that lies at the intersection of science and global policymaking. So Abby is going to give us a keynote for about 30 minutes, so there will be time for question and answers right after her talk, and she is going to focus on both the quality of learning environments and child development from two large-scale initiatives going on right now from the World Health Organization and a partnership between Brookings, UNICEF, UNESCO, and the World Bank. So thank you, Abby.
Good morning, everybody, and thanks so much for the chance to talk about measurement. I was joking earlier that if we still had bards, that we should have a measurement bard here who's sort of singing us songs about measurement. So as Hiro said, I'm going to be talking about measurement for kids birth to 8, and particularly in light of the Sustainable Development Goals. So if I could figure out, I don't know how I get these to... Thanks. So in terms of the main points and themes, I'm first going to give you a little bit of background on some of the details of the Sustainable Development Goals and the context that that provides for measurement. And fundamentally, I think that we as an early childhood community have some decisions to make, and that as we're facing this new agenda, measurement becomes one set of very important decisions that we have for positioning early childhood in the global dialogue. Then I will also be talking about creating equity through measurement in line with the theme of this meeting of what does it mean to promote equity through measurement, and what are some of the steps that we need to take, and then how we realize the contribution. Okay, so in terms, of setting the stage for measurement. So Early childhood development has made its global debut in the Sustainable Development Agenda, and it's mentioned, I think, as came up yesterday, in more than one place. It is in education. The target specifically focused on early childhood sits within the education goal. It's target 4.2. The words in this target are not negotiable. So this is the target that we've got. The amount of time and energy that it took to even get to this language was something that that would make us all, we all aged many, many years in a short period of time. So the challenge here for Goal 4, Target 4.2 will be creating a holistic enough dialogue and making sure that people understand that development starts at birth. Also then integrating non-formal pre-primary programs, parenting programs, health and nutrition, integration of all of those will not necessarily be intuitive to those who first see the language of 4.2. So that will be one of our first challenges. It's also the case that these goals are interlinked with one another. So early childhood has implications across many of the other goals, which means that then it will be upon us as a community to reach out to the other people working in the other sectors to help them see what the role of early childhood is in the work that they're doing, and for us to figure out then how we can best support one another's efforts. Overall, this is such an important era for early childhood development, and when I hear from member states and people who really don't know anything about early childhood, what's really remarkable to note is how much understanding there is of the importance of early childhood, even compared to 5 years ago. So we have this incredible opening and this opportunity with many new program models, growing evidence of the importance through randomized trials, and measurement as one important element to track the trends and the investments at a population level. So I'm going to pause just for a second on population level measurement. So what I'm saying there is that it's measurement that really is designed to provide a picture of an entire population and not to diagnose individual children. And when member states and other conveners get together, that's really what they're talking about when they say they want to know what's happening in early childhood. It's really population-based measurement. So in light of that, what do we see now that's different about SDG measurement? The agenda is very different and the measurement will be very different as a result. The first point is that whereas the MDG goals were all very specific and very measurable and very global, there's now a huge emphasis on regional and national monitoring. So there will be a small set of global indicators, but there's also a big push coming from member states saying we have measurement systems, we work within our own regions, we don't need somebody to tell us what type of measures we should be using. The second is that there's an emphasis on outcomes that cuts across all of the targets in education. And it's not only access. And then quality becomes very central. I think there's a growing awareness that you can't just have access, and that instead you have to really be focused on the quality of services. It's also the case that there are many expansive terms all throughout the agenda that are not defined. And how those terms are defined then, of course, becomes a really critical piece of measurement. We have many new measurement innovations that we'll be talking about later in this session, and more coming all the time. And at the same time, we have resources from governments that are very limited in terms of investments in measurement. That's not something that governments often want to spend a lot of time and money on. And then that we've got the data have to serve these multiple users. We've got globally comparable as one factor, as Hiro mentioned earlier, and we also have got to be able to use data for improvement. We're at a point right now that we can't really waste too much time of collecting data at a population level if we can't figure out exactly what we want to do with it and how we want to use it to improve services for kids. Finally, we've got the data revolution, and I think the session this afternoon will be very interesting from that standpoint as well, that we've got technology, we've got a lot of new methods, we've got potential new partners, all of whom can help us get to the next level in ECD measurement. So I wanted to show you this measurement framework for children birth to 8 that we published in partnership with Kimber and her team, with Tarandua and Pia Rebello Brito. And I think that this is a very simple representation of what I think here collectively in this room we agree upon, that contextual factors have an enormous influence on child development, that inputs are important, such as promising practices, that outputs, coverage of programs is really important, which in turn lead to child development. So our challenge now is how we translate this into feasible measurement at scale. And so if we all think that this is true, what do we now need to do to make sure that that shows up in all of the measurement systems that countries and regions in the global system are using? The good news is that we have lots and lots of experience to draw upon. In addition to the measures that will be discussed in the afternoon, and some of them are listed on here, the ADELA, we've got Eva who will be talking about the ADELA. We have lots of regional efforts of population-based measurement at or near the start of school. I think politically there's much greater acceptance, that I hear at least, of measuring kids' development as they enter the primary school system as opposed to other phases of life. So what you see here then are measures that usually start between the ages of 2 and 3, extend up through maybe age 5, and are designed for use at the population level, meaning tracking groups of children. So you can see that there really is quite a lot of experience that we can build on. So one of the key elements of the Agenda 2 is that it's intended to apply to both high and low-income countries. At this point in time, most of the measures that we have are either for low and middle-income countries or for high-income countries, and there are very few that cross that, even though, of course, we know that there's lots of inequity within countries as well as between. So that'll be another issue that we need to figure out how to deal with. So then going back to measurement and its contribution to the SDGs, I think that whether we like it or not, measurement will help to create a common language. And once we put something on the table in terms of how it should be defined, that will be a contributor to how people understand the Sustainable Development Agenda for early childhood. So whatever that understanding is of school readiness, which is not a term that I necessarily like very much, but one that shows up a lot in the public discourse, for a definition of quality that protects children's rights and supports their environments, these types of elements will be very important for the dialogue. And then as well, even though we've made a lot of progress in the early childhood community in terms of helping people understand the importance of early development, it's also the case that within the education arena and also sometimes among people that I talk to in health, there's a sense that we as an early childhood community are still a little warm and fuzzy, and that we're not quite as rigorous as we need to be about our data. I don't know that I agree with that, but it's just a perception that's out there and something that we're going to continue to need to address. So in light of that, I did want to give you a quick update on the indicators. So there will soon be agreement on one set of indicators for global monitoring. There was a meeting last week in Bangkok where they made quite a bit of progress. There will be 2 proposed indicators for Goal 4, Target 4.2. Right now, it's the MIX ECDI, which is an index of early childhood that MIX collects through a household survey, and access to, quote, organized learning. There will be a very strong push that we're anticipating to replace any outcomes measurement for early childhood with access to pre-primary education only as the global indicator for early childhood. So that's what we're anticipating within the next few months. We probably will need some very strong support from member states in order to advocate for anything other than access to formal pre-primary as being the indicator. We'll see how the process unfolds. At the same time, we're going to have sets of national, thematic, and regional indicators where there's quite a bit more flexibility and where there hopefully will be an opportunity to enter into a dialogue with member states about what's important to measure and how they can set up measurement systems. And again, that we need to come up with something ideally over time that applies to both high and low income countries, in line with this focus on decreasing equity. Decreasing inequity. I think that one of the other key questions, just to keep putting it out there, is that we as a community need to decide how we want to use the high leverage that comes from globally comparable data against our understanding of the most accurate way to characterize young children's development. And so that'll be a question that we can continue to debate. Okay, so if we're moving then from the global, where we have this high degree of interest and political leverage right now in this opening, to local, of what's happening within context for children and how do we bridge that gap. So I think I did my best to sort of summarize what I think would be ideal, and I'm really eager to hear people's thoughts, and where we are a little bit more commonly. So if we said that ideal is child development and learning, the measurement reflecting culturally relevant normative development for all children, meaning that we have good scales that include all children, that we're measuring context as well, that we've got family environments, schools, exposure to violence, a broad definition of context, and also that we have actionable data that derives specific changes for children, that might be something, characteristics of a system that we would eventually want to get to. And where we are now, or what we tend to see a little bit more frequently, is project-level measurement using a variety of tools, but not necessarily scaled, with governments may or may not necessarily want to take up these scales and to continue investing in them. We see a tendency towards a very narrow definition of school readiness, less investment in measuring children's environments than in outcomes, and usually at one point in time, and that very little measurement of access to services or children's development early in life. Even though we know, as we heard on Monday from the World Bank, great presentations yesterday too, that that's too narrow, and we miss a lot as a result. We also have unclear use of data to systematically improve, and I think that in the tendency at the global level is to really think about population level data, which is fine and it serves a very important purpose, but that there's a big question out there of what data actually leverage the highest amount of change. So that then I'm putting out some principles around measurement and service of equity for us to discuss, and I think that the presentations later will also be really helpful in further articulating these principles. So the first one would be ensuring that all children are counted and their skills are acknowledged. So that means that we would be creating measures for use across all settings so that we can capture children wherever they are, and for children from birth to age 8. Now, there's a question of whether then it needs to be normed for the local population. So norming scales is a big job. It takes a long time, and it's technically very challenging to do. But I think that that's a question that I would love for us to discuss, is how much norming is necessary for us to come up with accurate scales. That we would be measuring environments as well as outcomes, and that the data would show a clear pathway from action to improvement. So in this next slide, there are a lot of words, but I'm going to sum it up really quickly. It's basically trying to outline a role for the global in promoting local level measurement, so that if we begin with a certain set of principles that we all feel we can agree to around equity-based measurement, then can we come up with some tools and methodologies that then are adapted at the local level. So, but as we move to this larger scale measurement, we've got a number of tricky questions to resolve. The first one is the screening and population-based measures of how we bring those two together, so that if we've got great tools for identifying children with disabilities, if we've got population-based tools, how do we put them together to come up with a measurement system? The second then around measuring holistically, and then around using the data for improvement. So now I'm going to talk specifically about different types of tools. So in this little chart, I've put together 4 different types of tools. There's population-based tools, the diagnostic or formative, the screening tools, and contextual. And so these are all different types of tools that might be taking place within countries at the same time, and that then they all have different reasons why they're used and how the data are collected. And I think that over time, ideally, we would be able to help countries put together systems that pull from different types of data. I think that the odds of countries adopting one measure to the exclusion of all others is probably unlikely at this point. And then in terms of the tensions of integrating data from the formative and diagnostic and population-based is a question I would put to this group too. Can we do that? Is it possible for us to use some of the measures that have been developed for formative use or for diagnostic use and to use them to track trends and to describe equity at a population level? And if so, how should we best do that? We also have the pros and cons of using common measures across diverse settings, so that if we have global measures that have been developed in one place, then what's the sense of how those can best be used in other places? And then finally, that different types of measurement might require different approaches. So quality measurement, for example, it may not necessarily fit into the same type of structure that measurement of child development and learning would have. So that then in the projects that I've been working on, we have this question of how do we make measurement easier? That in low and middle income countries, the number of people who are available to work on measurement within governments is usually pretty limited. And it's not necessarily a high priority, nor do I think that it necessarily should be, given how many demands there are on services. So then the question becomes, what do we do to make it easier? Is there something that we can do at the global level that both reflects the principles that we've got and also bootstraps and makes the work at the country level a little bit faster. So there are 4 different levels that we've outlined then. One is that we use the same measure everywhere, the same administration, same items with a small amount of adaptation. The second is that we could use a common core of items. One small set of items may be part of a larger set and a more culturally adapted set, but one set that we feel meets a standard for applicability across settings. We could try to just have common constructs with items that vary. So maybe we agree that there's a certain set of things like social and emotional development or the quality of teacher-child interaction, but the definition of how that's measured in different places may be very different. And then finally, that we just do an item bank. And so we say to people, here are lots and lots of different ways that you can measure all of these different elements of child development. Which do you think is best? All of these would allow us to have some sort of message to in the global dialogue. But the level at which we are then attempting to summarize our information would vary quite a bit. So that would be a decision as a community that hopefully we could come to some sort of understanding of where we think we're going to get our highest political leverage. I'm going to talk now about 2 projects. One, the Measuring Early Learning and Quality Outcomes project, which is a collaboration with UNICEF, UNESCO, World Bank, and Brookings Institution, with support from the Children's Investment Fund Foundation, and lots of partners and lots of people who are involved who are here with us today. And then also the World Health Organization, Tarun Dua, has asked me to present a little bit of information about her Birth to 3 measurement project. These are both examples of how we're attempting to address these questions of measurement at scale. And I won't say that we've got the corner on any answers. I think it's more just a sense of how we're trying to think through these issues. So first, to begin with the World Health Organization, of global indicators for child development of 0 to 3 years. So I think with the World Health Organization project as well, that the Bernard Van Leer Foundation has also been very involved in it, so that as questions come up, I'm also very happy to have colleagues there to answer questions. So the first question that they had has to do with potentially existing and validated cross-cultural and feasible indicators that they could adopt for wider use. There are also then a focus on the magnitude of the developmental fluctuation between children between countries, meaning how much variance do they see? Can we collectively define normal and concern and delay? Which development milestones observable before age 3 are reliable predictors of outcomes? And then this feasible process for developing and implementing. So that then in pursuit of their goals, they're systematically assessing data from developing countries on children less than 3 on core items of global developmental competencies, evaluating the feasibility and applicability of all the valid items, and field testing. So what the process that they've done, it's been quite amazing to watch. They went through all of the different measures and then said, do these items look to be the same thing? If a child kicks a ball, child kicks ball 4 feet, for example, might be 2 different items and then measured in different ways. And they asked the question of, do these items work in the same way or not? So this is an example then of how they've summarized the data. And this is an item that they said had good item performance. So what you can see then is that for each of those different colored lines, those are different measures. So the ASQ in Indonesia, the ASQ in India, Peru, the MDAT, which is from Malawi, and then the Kenyan Development Inventory. And that then by looking at the average ages at which children achieve those, the conclusion would be this is a developmental milestone, because at the decimal age at the bottom, you can see that those lines all line up around year 1. So this one here, it's walking. So of course, you would think, yes, that would be something that would emerge on a relatively consistent timeline. So then this would count as a good candidate for global measurement. And that then would be something that could be considered a milestone in a lot of different places. Okay, so for a very different approach, for MELQ, what we did is we began with expert groups on quality and child development and learning. We do have some of the same depth of data that exists for children's development birth to 3, but as we all know, the nature of children's development as they get a little bit older changes. So the environmental influences are greater, and you can even see that in the WHO data as children get a little bit older, that those lines start to spread out a lot. So that tight curve that we see around walking, you just don't see that really as much as kids get older. So it requires a different approach. We used existing measures to come up with a new set of items. We drew heavily from the ADELA, which Save the Children's Instrument that Evelina will talk about. We also used the ASQ, the Denver Developmental Screening Scale, anything that had been tested in more than one country. The East Asia Pacific Child Development Scales was another place where we drew items. We have two new tools then on child development, learning, and quality. The purpose of this exercise, though, wasn't so much to come up with a new tool as it was to come up with a method for defining a common core. So we were sort of banking on that second option that I showed you earlier, which was, okay, well, let's say that we do have a good deal of national adaptation, but can we come up with a common core that we could use to compare across settings? We're also looking at some of the institutional supports that are needed for scaling, and we have a nationally representative study underway. So I'm just going to show you the framework that we used for developing the child development and learning items. So we had this core set of items, and again, our goal of can we find core items in social and emotional, in domain general, meaning executive function, and in domain specific early literacy and math. And we now have data from 7 or 8 countries, and the very quick summary is that it looks as though there's more consistency in the way that children respond to items in literacy and math than there is in social and emotional development, and executive function is somewhere in the middle. So it really becomes a challenge politically then with that idea of a common core, because we could be in a position of communicating to governments that we have a common core for early pre-academic skills or literacy and math, however we'd want to call that, but not for social and emotional development. And I think I'm afraid that if we were to go that route, we would be reinforcing the idea that you don't need to measure social and emotional development, which couldn't be farther from the truth. So I think that those are some of the tensions that come up when you actually start to look at the data, is that things get a little bit tricky. So then just a few words on quality measurement. We also had this tool for MELCO that was focused on quality, and we began with formal pre-primary environments. So not because there was any sense that that was the most important type of environment, simply because we needed to start somewhere. And so then we began with those environments. And we had questions around whether it was possible to use political leverage to measure quality. So it was not part of the MDGs, so there was only access to primary education. It was considered a huge miss in that many, many children enrolled in extremely low-performing schools. And so now, politically, there's an opening to measure quality in ways that people will pay attention to. And then we had this question of whether it was possible to define items or constructs that are comparable across countries to at least serve as a starting point. And we hosted a meeting last year with Bernard Van Leer and Isa around this question of common constructs and to begin addressing that question. And then we had this question of whether quality measurement can be connected to child development and learning, and then also how it can be built into the monitoring and evaluation systems for an emphasis on improvement. So I'm going to talk for just a second about quality monitoring, because I feel like it's a really, really critical piece of quality measurement. So in most countries, there's some standard, there's standards written about what quality settings should look like. People may not know what they are, but they're there. They're usually written there. So what we did, we looked at the SABER ECD, which is a World Bank project, and OECD on the state of monitoring and evaluation systems around the world. And what we found is that there's very, very little consistent information about monitoring quality of services or implementation really anywhere. In some high-income countries, they do a good job, but in a lot of places, there's just not really much that seems to be available. There's agreement on many of the key constructs of quality, so like the principles that ISA put together and some of the other principles that are out there. I don't think there's a lot of disagreement about those. I think people have a good sense of what the characteristics are of quality environments. But there's very little support for actually improving. So that we may agree on these constructs, but there's not much in place that actually helps people reach them. And finally, there are very few tools that are available to help countries measure quality at scale. And of the tools that are available, they're really narrow in focus. So there might be one on formal pre-primary environments, but there's nothing on home visiting, there's nothing on services for children with disabilities, there's nothing that really goes beyond a very narrow definition. So I think that the sense is that we have a real opportunity to try to figure out how to move forward in measurement of quality. So when we're thinking about measurement and quality and how they fit together with child development, that we put together a conceptual model then that outlines roles at different levels. Beginning at the bottom level, if we said at the policy level, that would be the policy structure, and that's an extremely important piece of quality. meaning the types of regulations that are in place, the connection to the national standards, and the amount of funding that's available that our group considered to be a key element of quality. Then at the system level of professional development, which again seems to be largely absent from many of the countries that we looked at least from the information that we had, and the resources in the school leadership, and then to the classroom or setting level, and then finally child development in a different color, because I think that the message that we're trying to send is that you can't just measure child development and learning without understanding how it fits together of this larger system. I think in terms of data use over time, we would be able to identify a decision maker at each of these levels who could use the data. So if you're thinking about helping somebody make better decisions with data, then you have to define what types of pieces of information they would like and how we can help produce that information. And thinking then through to how quality influences child development and learning. This table here, it has backwards arrows on purpose because it begins with the policy side of the policies that need to be in place, then all the way to what the children need to achieve. So that if you had adequate funding for preschools, then you would also need curriculum that has age-appropriate expectations. You need counting materials, and then maybe you could expect children to learn how to count in the way that you were anticipating. So we have a little bit of experience to date. We thought, as I said earlier, there isn't a whole lot of disagreement among our expert groups about the constructs, but I think as Hiro had a very interesting experience in Colombia recently that he might be able to mention, that they didn't necessarily think the constructs worked for them, that they had different names for the constructs of quality, and that what we had generated didn't really resonate with them. So then the items too may substantially vary from one place to the next. And that we're finding that there's not necessarily a lot of alignment between an global ideal of quality and how it's implemented within countries. So that then the next question becomes defining quality ranges, item banks. What's the solution? Is there a technical solution that allows us to take advantage of political leverage while still staying true to what countries are experiencing? And then the implications for equity and measurement. I think that one of the other experiences that we've had, certainly a principle that we've got, is avoiding high stakes. And one way that you can avoid high stakes decision making on data is by sampling, so that you never have full information on any population of children, and it's actually a lot less expensive too, so that you can then pick and choose and do representations. I think that the question of high stakes testing, especially around school readiness, is a really, really critical question in many countries, and that they would we had the sense of even talking to some government officials that making the decision to have some children out of the primary system would actually be beneficial, that they would prefer that because these children don't necessarily have a strong basis. So that's something that we're going to continue to have to monitor. And of course, that definitions of healthy development, quality, and equity vary by place. And so that question of how we get the cultural norms and the lens that we need in order to adequately interpret the data it continues to be something that we spend a lot of time thinking about. And then using the data to build effective professional development systems and M&E systems is really important. And my sense is that we collectively don't know enough about that, and that's something that we need to explore more fully. So in terms of our next steps, what we see at the country level is a lot of demand and a lot of willingness to engage with very few resources. Very few structures in place in many countries to support partnerships with researchers and other experts who are coming from local universities. And so that if we can help facilitate those strong connections between people in countries working in universities and the government, that may be a way that we can support them. And then at the regional and global capacity, we're seeing many investments in measurement happening in many organizations, but it's not necessarily coordinated. We don't necessarily, I think, have a sense of how to best maximize the investments, and we need to potentially invest more in building measurement systems. And then in terms of the discussion questions that I had upon looking at the other presentations of the successes of the measurements to date, how we can build upon them, how we can take advantage of the global emphasis on ECD, and then how we can best work together to support the integrated action at country level, and how we can use our collective experience to move forward. Thanks.
We have about 15 minutes for Q&A. which Abby will field. No? So the topic of this panel is measurement. No. We have been mic'd. So we have about 15 minutes for a Q&A, which Abby will field, unless you want me to
Yeah,
field.
no, that's great. I think, yes. I think that was the first hand I saw.
Thank you very much. That was a really fascinating insight into the process. So I have a couple of comments and questions. So one of the opportunities with the SDGs is your opening slide of looking at how we can harmonize some of these measurements across various SDG goals. So particularly, linking health, poverty, some of the equity measures to what we have essentially as school, quotes unquote, readiness. So what isn't very clear to me here, and I would appreciate your views on this, is how are we going to link this to what is already being recognized as the bunch of risk factors for delayed child development within the the SDG 3. So in our Lancet ECD work, the two measures that are being used to quantify delayed child development, one is stunting, and the other is extreme poverty. So you're taking an interface of the two. So my question really is, how is this going to come out of the silo of perhaps the education system, what we have within the health, nutrition, and poverty assessment systems? And that brings me to which particular surveys or measures are going to be used in countries. So I completely support the notion of local ownership, but that also means that we would have to rely on what countries are going to use, and there are really no equivalence of vital statistics here. These would have to be measured by cross-sectional surveys, which would most likely be piggybacked on either the multiple indicator cluster surveys or the demographic and health surveys. And if so, could you say something about sampling strategies, in particular in terms of getting the right sample size to get measures in terms of district-level specificity? So increasingly, these DHS surveys or multiple indicator cluster surveys are taking as a unit of measurement the lowest common or possible geographic denominator. Right. So getting something from you on this would be very helpful to understand how we're going to harmonize these indicators across various sectors.
Okay. Is it okay if I think I'll go ahead and answer that before we take others? Is that all right? Okay. So a few thoughts. And again, dividing the measurement universe into different categories: global, regional, national. On the global level, what is likely to happen is that either UNICEF or UNESCO Institute for Statistics will have the responsibility for reporting on 4.2. They will use existing global data, meaning mixed survey data, or for UIS they collect pre-primary enrollment, and then the stunting data, which they've already got. So you'll have, a report that will have these three indicators. From the same, nah, not necessarily. Not necessarily. I mean, the questions are worded in different ways in different surveys, but it'll be similar to what you see now when you look at their, sort of sheet, the state of the world's children, meaning that it's global data coming from different sources, and people put them together, and I think for the most part, nobody really looks at one child's constellation of factors, because the data don't allow that. So it's, groups and chunks. So I think that's, unless we collectively come up with another alternative, which I think the Lancet series will be great for exploring, that's what you're probably likely to see at the global level. The opportunity is that at the country level, I think that what we're experiencing is incredible demand. For MELCO, we have 20 countries who have said, we'll participate. And so they aren't household surveys there necessarily. It depends on the country. Some of them are preferring to measure kids when they start formal schooling, which means that then it's still not 100% of the kids, but you're getting closer. And that then you can get contextual information on individual children that way. The reality is that for the next 3 years, unless we decide to use secondary data analyses or some other method, the global isn't going to look that, I don't think it'll look that different. If we can support countries in getting better data, then I think that is probably, to me, seems like it's the most viable path forward. And that the sampling questions, I think, are doable. Like we connect with the sampling, the statisticians within countries. Some have better data than others, but it seems like we can do it. And so we're getting representative samples then in the places that we're working. I don't know, Hiro, if you have something to add to that.
Well, I would say that 2 levels of sampling considered together would be a new direction for, in a cross-sectoral way, to think about the population-based sampling of, let's say, early learning kinds of programs together with the population sample of families, right? So we would have those 2 layered on each other, and I think that's a very important new direction to think about. And then, of course, we can think about kind of things like health clinics or, those kinds of things. A variety of the kinds of service institutions that together represent a comprehensive ECD program or policy, I think we do need to think carefully moving ahead about how those would get integrated. We have certainly examples in different countries of national household surveys to which contexts, direct measures of contexts are appended.
So let me just finish my thought on this, which I think is probably a direction we need to go. So I chair the countdown process, 75 countries, which have 98 to 99% of the global burden of maternal-child morbidity and mortality. So going forwards, till 2030, there will be a countdown process that will build on what we had. But increasingly, the recommendation that's being made is rather than doing these completely independent poverty assessment surveys, and then we have these health and intervention coverage assessment, which also needs to include quality of interventions. And then we have totally separate, education or school readiness, which will probably be used for some of this. So it doesn't make any sense to do those as 3 disparate efforts. It's much more cost extensive. It does not have the same sampling frames, doesn't measure the same groups. The school surveys I've found, at least in the geographies that I've worked, almost never capture the diversity of the rural population. So you have largely urban, they go where the schools are. They don't go where the population is. Mm-hmm. So increasingly, it's very difficult to build a homogeneous picture. So the opportunity going forward, just given the contextuality, the risk factors, what we are trying to achieve as these cross-cutting SDGs, is to build indicators around the same platform. And the reality is that at least in the 75 countries with the highest burden, they are going to rely on household surveys, at least for the next decade, before they get on to CRVS or anything else.
How about the next 3 or so?
Sure.
As a group?
Hey, is this on? Yeah, it's on. Can I ask this? Sorry. I'm Steve Adler. I work for IBM, and we're an anchor partner in the Global Data Partnership for the Sustainable Development Goals. And I have a little bit of a contrarian question, because it just occurred to me listening to you that as we collect more data and we encourage countries to build better statistical capacity, of course, we are the customers for that work. That is, the people who are already educated are the primary beneficiaries of more data. So how long do you feel, I'm asking you as a professional, how much impact are we going to have, how much indirect impact are we going to have on the uneducated while we spend money for our own education? That is, you know what I'm saying? Mm-hmm. We're all the consumers of more data in the developed world. How much time will it take for that to impact the developing world?
Yeah, thanks. Can I answer it as a, sorry. So I think I'm glad you asked that, because I think I must not have been clear in the presentation, is that when I say data for decision making, I'm not talking about just somebody who's got a PhD in statistics. I'm talking about a teacher or a caregiver of what information they need in order to be able to do their jobs better, which then has a very strong link to professional development activities. So that if the piece of information that we are able to produce has to do with the amount of time that a teacher has read to a child in a classroom, and you say, you know what, you're at 7 minutes, do you think maybe we could increase to 10? And I don't know that that's necessarily the right example, but I think that that's what we're shooting to do. And that you're absolutely right. The demand for data comes from, that's part of what happened with the MDGs, is that the only demand that there was for the data on the MDGs were the people who made the MDGs. Like nobody else, I don't think really cared that much. So I think that what we're trying to do is to make the data available in ways that's powerful to people who are actually making the decisions about kids.
Yeah, I've seen some programs like that in Burkina Faso and other places where local schools have taken advantage of data. I'm curious, are we measuring the local consumption versus the global consumption? To your point about MDGs versus SDGs, is that a metric that we're developing to evaluate how much of the data is being consumed locally versus by us?
I think that it's a great question, and I could think of lots of metrics, but I do not have one in my back pocket today. So, yeah.
But we do know that civil society organizations are using in certain countries data at different levels, at national, especially if they're broken out at the regional. And there's a big question of how much they're broken out at the local level. But we have instances, as you probably know, of data being disseminated to civil society that then produces another avenue towards change than simply the government path.
Hi, this is Vibha from Mumbai.
Yeah.
I had a question, Abby. I don't know if there's data on this already, but I wonder if you see this information or this kind of measurement being used to measure the harm that poor quality preschool education can do. And I think there is some emerging data on that, and the reality of preschools in a lot of the low and middle income countries now is that they're a preparation ground for entry into a big school, huge classrooms, few teachers, poor quality education. And I was wondering what your thoughts are about that.
Yep. Yeah, go ahead. Yeah, sorry, I'll try to be more efficient in answering questions.
Okay. Am I on now? Actually, Abby, I wish you could go back to a chart, the one on which you commented with the arrows pointing the other way.
Yeah.
Okay, from the systems level all the way to the child assessment. This is more of a commentary than a question, really, because I think some of the questions that are coming up and points that you've made earlier, Abby, sort of acknowledge the challenges of measurement.
Keep going.
And I think one of our challenges is that we will sort with the technical aspects of measurement and the need to come to the local level. I think those are things, to the extent that we agree that there are problems, we'll keep working on them. Mm-hmm. I think one of the biggest concerns, which is also reflected in the question by our IBM colleague, is that we run the risk of measurement taking on a life of its own. Mm-hmm. Right? And everybody is interested in measurements, and trying to figure out a way to do things globally. We are interested in international comparisons because, of course, we're a global community and we want to know how we might help. But actually, that interest in global kinds of indicators actually go counter to what we need to do at the local level to really make a difference in the lives of people. And especially if you look at it from an economic standpoint. If we spent all our efforts on measurements and randomized controlled trials, and none of that money is going into things that probably are necessary so we can do our measurement, then we really run a risk. Right? So we can do measurement, we can publish measurement data, we can educate ourselves about measurement. In the meantime, the measurements make sense only to the extent that we actually are changing lives in the real world. One of the reasons why I like this is I think if you look at probably all the advanced countries together, we are a global community that loves to get outcomes. We're always shooting for the goals. We are measuring children. Actually, what we should be measuring should be some of these areas, right? So that's why I like the way these arrows are going there. Mm-hmm. You cannot accomplish things at the child level without accomplishing things at the systemic level. Mm-hmm. So we need to begin to put some of our efforts into really looking at the real-world environments in which children live their lives, because at the end of the day, it's easy to assess children. What may not be easy to assess is to what extent our systems really position children to be able to do well. Thank you.
Yeah.
I think that's it for now in terms of those two questions.
Okay, great. So agreed that the evidence on low-quality care would be incredibly useful. I know that there's some in the U.S. Just recently, Tennessee, I think, came up with a study. I've had a harder time locating studies from other parts of the world. So if you know them, please send them, because I would love to start to accumulate a base. And so, and on the other point of this, thank you, and thanks for the comment, and fully agreed that we have to start doing a better job of measuring the system. And I think that that understanding then how the data can be useful for any one individual is really my own personal crusade. So I'm really very open to ideas that people have on how we can do a good job with that.
We're going to have plenty of time for questions, so hold on to your questions until later, a little after 11. But let's thank Abby for her spectacular keynote. In the meantime. Now I'd like to invite the three folks in the panel. Unfortunately, one person couldn't make it today, Ruth Peru, but we have Holly Hicks-Small, Eva Borisova, and Vibha Krishnamurti. Okay. We actually have all four presenters, and Ruth is going to present by video from where she is. Or she recorded it or something. The panel is as large as it can be without anyone falling off the stage. So, which means we have some great variety in measurement here. So, first we're going to have Holly Hicks-Small, who's an assistant professor at Portland State University, who was introduced, and you heard from her yesterday. Then we'll have Eva Borisova, who is Director for Impact and Innovations in ECD at Save the Children, and then Vibha Krishnamurti, who's with the Ummid Child Development Center. Again, we heard from her yesterday, and this will be the second time. So I'm not going to introduce each of them, but each of them will talk for about 15 minutes. And what we did with this panel, just so you have a sense of what our ambitions, were that for each of these presentations we asked for a little bit of information, objectives of the particular measure they'll be talking about, whether it's of context or of child development and learning, whether it can provide information to identify kids who need more detailed screening. For measures of context, is there evidence on links to child development, growth, health, and learning, examples of how the tool has been culturally adapted, and utilization examples in policy and practice, especially for marginalized or excluded children, thoughts on a future research agenda, and any ethical considerations that may have come up for this measure in implementation or use in practice or policy. So just to give you some food for thought around any questions you might have based on these presentations. So let's start with Holly.
Yes, I'll do my best to go through that all in 15 minutes, so get started. So here you see the Battelle Developmental Inventory. That's the kit that cost about $1,000 and $3,000 for training. That's often something that people want to see us using out in the field to evaluate our randomized controlled trials. It's not very feasible, and so I'm talking about an alternative to that, as well as a screening tool that's quite well known called the Ages and Stages Questionnaire. But first, I just want to have some definitions really clear. I showed this yesterday. A screening tool is really meant to just answer the question, does the child need further assessment? That's it. It's like a Polaroid snapshot in time, and a child who doesn't appear to need further assessment is developing as we would expect, that could change over time due to illness and other factors. Assessment tools like the Battelle or the Bailey, they're very expensive. I have an X-ray there because it's in depth. You have to have a lot of professional training to use these tools, and they are often used for eligibility determination. One thing that I don't hear people talk at all about are programmatic tools. That's not comparing a child to a normative sample. It's looking at a child's individual growth over time. And of course, we need to evaluate whether children are making progress. This is really for children who come into the early intervention or special education system, but I think it applies too to what we're talking about here today. The Ages and Stages questionnaire inventory was developed from a screening tool from the Ages and Stages questionnaire items. It actually still has the ASQ items, and I'll explain how it does that, but it can be used to evaluate a child's progress over time. However, it is not the kind of tool that you want to teach to, and I just want to be clear about that. The ASQ was developed 30 years ago. It has a lot of research behind it, and I'm very happy to share all the publications from the global research that's actually been done on the tool. It was originally developed to follow children who were very premature and at risk of developmental delay. And over time, people started stretching the use of the ASQ, and that included large donor organizations who were trying to measure the effectiveness of their interventions. It's really not appropriate to use the ASQ in that way if you have another option, and I'll explain why. And so due to that, the ASQ inventory was created by Jantina Clifford at the University of Oregon in 2006, and it's been studied outside the U.S. in Taiwan, Madagascar, Kenya, as well as with indigenous populations in the United States. The ASQ inventory is now ready for wider research use, and so if you're interested, please do talk to me about that. The ASQ as a screening tool has been used as a population-based measure. Currently, the United Kingdom is using it for all children aged 24 to 27 months as a population measure. So again, I'm kind of jumping between tools, and you'll see why. The ASQ is a screening tool. It is meant to identify children who are at risk of having developmental delay or disability. It's for kids 1 to 66 months of age, and it looks at 5 developmental domains, communication, both expressive and receptive, gross motor, fine motor, and so on, and there are 6 questions in each domain, and it is a parent-completed tool. It can be completed by other people, but it is meant to have parent involvement, and that's one of the things that sets the ASQ tools apart. The ASQ inventory is a progress monitoring tool, and right now it is available for children 1 to 36 months. It's one questionnaire, and the questions on the ASQ in the individual domains were reordered, and I'll show a slide that illustrates that. The number of questions varies based on the start and stopping rules, and so the reason the items don't go beyond 36 months is I don't know what your experience has been, but my experience using other tools has been that there's a ceiling effect. So the difficulty of the items actually do go beyond 36 months. But there can be precocious children, you know, in low-income countries, right? And so we have to make sure that we're looking at their full progress and not hitting a ceiling. As well, the ASQ inventory is quite nice because you could have a 6-month-old who's actually functioning more like a 3-month-old, and I know I've experienced that, and the ASQ has been problematic for those children, whereas the ASQ inventory, you could start lower at that 3-month-old level. The other thing I should note is that the ASQ3 is available online and in certain countries, and the ASQ inventory has been used quite successfully in tablet version. So when we look at the structure of the ASQ, if we look at a 10-month-old screening tool, the items are actually hierarchically ordered. And IRT analyses as well as other methods have been used to determine the order over the past 30 years. So if we look at items 5 and 6, they're really set at the 10-month-old average. It doesn't look at children's development above average, whereas items 1 and 2 are actually set at the 6-month-old difficulty and items 3 and 4 at the 8-month-old difficulty level. When you look at the 12-month-old ASQ, the harder items actually become the first 3 easier items. And in this way, the questionnaires are linked. And that's something that people don't understand about the ASQ, and that's one of the key reasons why it shouldn't be used as an outcome measure. It is a screening tool. The ASQ inventory looked at the different developmental domains. Here we can see the gross motor domain, and the items were lined up from the younger interval items to the older interval items, and there are suggested starting points based on age. So you can see 6-month-old up to 9-month-old babies can start at item number 12. When your baby is on her tummy, does she straighten both arms and push her whole chest off of the bed or floor? So items are scored not yet, sometimes, and yes, just like the ASQ. And you have to find the basal, the starting point, and the stopping. And so there are explicit rules for that. Does that make sense, how the items have been rearranged from the ASQ? So they are ASQ items. When we look at screening, what we're trying to do is see, the child we go through, but we do hit a ceiling. So that's what this graph is meant to see. We use cutoff scores to determine whether the child's progressing as we would expect. Whereas the ASQ inventory, we do not hit that ceiling and we can keep assessing. So that's what I'm trying to illustrate with this. And we can look at developmental progress over time, and we can also present the scores in percentile growth charts. One of the things that I want to emphasize is that the parent is still involved in the administration of the ASQ inventory, and I think that's really crucial. Some parents actually report that completing a tool like the ASQ is the equivalent of going to parent education, because they finally understand the different developmental domains, and they are very interested in their child's development. And when we use the ASQ inventory, what's nice is when you do graph on percentile growth charts, you can involve the parent in that so they can actually see their child's progress over time as well. Parents answer the ASQ inventory items, but there are direct demonstration items as well. And I know that a lot of people think that parents in low and middle income countries can't answer in a reliable and valid way on their children's development, but the emerging research suggests that that's not entirely true, and some parents in Madagascar were actually underreporting on their children's development. So there needs to be more research, but so far what's coming out is quite promising. So parents do they actively try and elicit the skills from their children when they're completing the ASQ inventory with the administrator. But the last resort would actually be direct tests. So I just want to emphasize that it's still supposed to be a fun, efficient process of completion like the ASQ has been for families. At the same time, the ASQ inventory can show us a lot of very interesting information. It is used successfully in several countries. The ASQ Extended was a tool that was developed by a group of researchers in quite the same way. It's not the ASQ inventory. It just used a few developmental domains. Here we can see children's basically their equivalent ASQ inventory scores that have been converted to a Z-score across 4 countries, and we can see the results for children who were from higher SES families compared to lower SES, and the discrepancy from 4 months to 24 months. And other work was done with the extended ASQ, which is, again, really the equivalent of the ASQ inventory, on parent engagement activities. And I do think it's important that we have a tool to look at the impacts of our intervention approaches. And here, basically what we're seeing is that when parents are actively engaged with their children, children are making more progress according to ASQ inventory scores. The ASQ items already exist in over 37 languages, so if people were interested in using the ASQ inventory, all they would need to do is align those ASQ items. Normally, it's academics that are involved in the process, which is quite involved, a front and back translation and piloting and so forth of the ASQ translation and adaptations. It's really important to look at linguistic equivalence, functional equivalence, metric equivalence, and cultural equivalence of these different items. And there are two different administration formats of the ASQ inventory. The ASQ inventory can be item by item, by domain, and also items grouped by activities. And what I mean by that is it's quite possible and has been done successfully where you can arrange culturally appropriate activities that are more authentic and natural for the child and collect the data through mostly observation. And I think that is quite good, because if we pull a child into an unfamiliar setting with an unfamiliar person, we have to really think about the reliability of the data that we receive through that process. And we're talking about infants and toddlers here. So it is flexible in terms of administration and quite promising. I do want to say that it does have strong technical properties. There have been concurrent validity studies with the Patel, face validity, test, retest, construct, item analyses with IRT, and the domain correlations with the BDI range from 0.89 to 0.99, so they're quite high, and I can talk to people about these different statistics if there's interest. There are some policy implications. In practice, administration of the ASQ inventory has been 3 to 4 times less expensive than the administration of the Battelle. It is quite low cost and change sensitive, and I think that's really important, and it's a trade-off when you don't have very many items. You know, are we able to sensitively pick up change in children's development over time? And some of our interventions are not over a long time, so we need to be able to have a tool that can sensitively pick up some change. So program implementers may want to use the ASQI to improve their programming, as was mentioned. Also accountability to donors, increased parent awareness, as I mentioned, and policymakers have an option for a more robust measure to assess child progress, allowing for program comparisons on child outcomes. There's absolutely a need for further research to determine the ideal administration methods in different world regions and contexts, as well as item functioning within and between population groups. So I'm very conscious that we shouldn't exclude particular population groups. We have to make sure that tools are functioning as appropriately for all groups within a country, for example. So we've talked a lot at this meeting about Roma. We can't exclude Roma from our determinations of whether tools are working appropriately within a given context, for example. There needs to be additional concurrent validity studies to determine the cultural, relevant comprehensiveness of this assessment and determine country-specific percentile ranges if that's of interest. So some of the things that the researchers of the ASQ inventory are interested in is whether the data can be collected within, a region to determine some of the regional or country-specific percentile ranges. So you could look at how different groups are doing. And this is the ASQ working group. And I think that's it. So I might even be ahead of schedule. No. Just on time? Thank you very much.
Just on time. Thanks so much, Alex. Evelina? Thanks.
So it's the green arrow? Yes, perfect. Good morning, everyone. It's really a pleasure to be on this panel on measurement. My name is Evelina Borisova, and I work with Save the Children. I've been doing a lot of work around our impact and evidence building globally. And whenever I am at meetings like this talking about measurement, people usually do a double take. You're at Save the Children, aren't you implementing programs? And In fact, we are implementing ECD programs in 75 countries as we speak, but we're also extremely grounded in evidence-based approaches and solutions, and this is where our interest in measurement is driven by, and I think is grounded in as well. So what I'll talk about is our efforts over the last couple of years to develop instrument, which is new in some ways and old in other ways, to really help us both track impact of programs, be accountable to donors, communities, governments, as well as be able to have some comparable data across different sites that we work in. And this effort has grown, starting with Save the Children, and has now kind of grown into partnerships beyond our expectations, I think, in really positive ways. So a lot of what I'll show is not just work by Save the Children, but also work by other partners who have kind of joined the effort and helping us learn how this tool is working across sites. So a brief overview of what Hero mentioned, and again, it's a high order for 15 minutes, so I'll try to, it might feel like I'm skimming through a lot of important information. Feel free to ask questions at the end. I'll briefly speak about some characteristics of IDELA, the International Development and Early Learning Assessment. I would really like to spend more time on exploring the margins, because this meeting is very much about children at the margins and what we find by looking at data for what margins actually look like and how we define them. And then I'll talk about tracking effectiveness of programs for policy change and really implications and this idea of how actionable is the data that we're getting from these global assessments, and what can we do with this data and what has already happened in some settings. And I'll very briefly touch on future directions. So let me start with the characteristics of IDELA, and I think it was very nice to have Holly before me, because she was speaking about the ASQ, which is really focused on the younger age group. So IDELA is very much targeting preschool, pre-early primary grades kind of age group. So 3 to 6, with extensions to 7 in some contexts, depending on the level of experience with early childhood or background of those kids. But it's very much in that middle part of the continuum of early childhood development. When we embarked on kind of this journey of developing a tool that would serve our purpose as an agency, which is really a global purpose, we wanted to have a tool that we would be able to use globally. But one of our top priorities was that it would be feasible and possible to use in low-resource, low-literacy environments, which is very much where Save the Children does the majority of its work. And this is where the gap that we were hoping to fill was, because when we looked at available tools, there were really very few that seemed feasible and that actually made measurement possible in these sorts of environments, so really underprivileged, low-resource communities. We obviously wanted it to be informative to the communities where we work, to programs, and to policymakers, so looking at different stakeholders, and again thinking about how actionable the data that we receive from an instrument can be for policy change. And of course, we wanted to have some international comparability so that we can say something about how our program is working in this setting versus another setting. So this is kind of the backdrop of the tool. I will not get into the story of how IDELA was developed, but I will mention just a couple of important points, I think, linking to Abby and Holly's presentation. When I think what's interesting about IDELA is that it balances very nicely kind of the bottom-up and the top-to-bottom approach to development. The top-to-bottom approach is kind of linked to, IDELA really is based on existing tools and on synergies and overlaps that already existed in constructs and in what other tools out there were already measuring. So in a sense, we didn't necessarily come up with new constructs. We really looked at where the connections were were the overlaps, and we tried to find which of those items and constructs were most feasible and most relevant across many settings. The ground-up approach is really how IDELA was validated and really brought to life in terms of being feasible and practical tool. Those items were then tested in 12 different countries in very diverse populations, looking specifically at the practicality and the feasibility of what it's like to measure these particular items across these populations. And there's a lot of careful considerations, both qualitatively and quantitatively, to really make final decisions about which items really made sense to retain and to really constitute the tool that I'm describing to you today. So I really like bridging these two components. So what is IDELA? I think I've already talk to you about some of the key characteristics. It's a direct child assessment. It is intended for global use in the sense that we have already used it in a lot of different countries, and we meant for this tool to be used in varied contexts across the world, across the globe. I think with the focus still on low and middle income countries, specifically the more underprivileged populations, that I think other tools have not we were not able to use them previously. It has been successfully adapted to date in up to 25 countries, so it does work in terms of adaptations, and I'll speak a little bit to that later. The intention of IDELA was really to monitor and track progress of a particular population. It could be at a community level, it could be at the regional level, within a country, it could be at the national level, but it's really a population-based tool in the sense that it's not looking to diagnose a child or to screen a child. It doesn't have a cutoff score, and it's not normed in the way that the ASQ is meant to be used. So it's really not a diagnostic or a screening tool in that way. It also is intended to track impact of interventions, which is a key question for Save the Children, to compare effectiveness of programs, which I think more and more practitioners in the field are looking to answer questions around which program is more effective in addition to the cost-effective side of the issue, and really to improve policy practice and inspire more investments, both nationally as well as globally. So I'm pressing the wrong button. When we looked at kind of the constructs that were out there, we wanted to make sure that we retain a more holistic nature of the tool. So it looks at 4 developmental domains: motor development, emergent language and literacy, emergent math, and social-emotional development. And it has some cross-cutting elements, things like approaches to learning and kind of kids' motivation and persistence to tasks, as well as a little bit of self-regulation in there. It's hard to do all this with 24 items, and I think this is what we're excited about, that it seems to be working so far. And we are able to retain some of the domain-specific kind of specificity and scores, as well as have an overall understanding of the broader kind of school readiness or holistic development of kids. It takes about 30 minutes per child, and includes 24 items across these domains. And it is meant to be somewhat fun. So tasks are really developed in an interactive way, in a sense that kids shouldn't feel like this is necessarily a test. There's manipulatives, there are ways that kids interact with the materials and the questions, which of course is very, very important for this age group and making the tool actually realistic and practical in the field. I wanted to come back to Abby's point about kind of bridging the global with the local, the national level versus a global level assessment. And it's very much the way we sort of conceptualized IDELA, thinking about these 24 core items that I kind of flashed very quickly at you in the earlier slide, and those subscales in the 4 domains, but having a lot of flexibility built into the actual instrument that could be contextualized at the national level or regional level, or even linguistic level, depending on what kind of diversity you're working with in a country. So in addition to the core items, there are optional subscales, like some countries are really working on health and hygiene practices in preschool, and they could ask specific questions around that. There is an upward optional extensions to a lot of the items or to the subscales themselves to avoid ceiling effects in some of the more urban, middle-income, highly developed populations. That doesn't mean that they don't use the items in kind of the core IDELA items. It basically is adding to those items a few extensions upwards to make sure that we can track progress, as Holly was saying earlier, and make sure that we can say something meaningful about what kids are learning and how the programs are impacting them. And then there's a lot that happens in the context or culturally specific items that country teams or partners feel they want to add to the core IDELA items. And this happens across the board. I can think of maybe one country where this hasn't happened. Across the 25 countries to date, there's always something very culturally or context specific that they feel they want to add to the items that are already in IDELA. And I think that's what makes it both flexible and at the same time comparable, and provide some of these global linkages between countries and contexts where we're able to use the assessment. A very quick flash of where IDELA has been used to date and where we're planning to use it by the end of 2015. As you can see, it's in quite a few places, and the partnership and the demand is growing around it, as Abby mentioned, and Hiro has referred in his presentation. This interest to really measure and understand what we're gaining from engaging in early childhood services and from providing programs is really it's really fantastic. I can talk more in the Q&A about kind of adaptation across settings. We do follow a kind of pretty systematic process, and every time we introduce the assessment in a new country, or where a partner is introducing the assessment in a new country, certainly the actual manipulatives or the kind of the tasks that we use throughout the assessment are adapted to the local cultural context. There's a very strong translation process that happens as well. But we find that for the most part we're quite successful in being able to bring a generic assessment into the particular setting and make that work across pretty diverse populations. So I think it can be done. To the question about can it be done to adapt a tool to various settings, yes it can, and I think it can be done quite successfully. We do have obviously manuals that help standardize some of these processes and help partners guide them through the process of how to adapt a tool, but I think for the most part we've been quite successful at this. So I want to move now to the kind of the question that I'm excited about, and I think it's been an area that Save the Children has put a lot of effort in, really to think about how do we define these margins and understand the vulnerabilities and inequities through data, especially in our case data coming from these multiple countries at a pretty large scale. And yesterday we talked a lot about kind of very specific groups and vulnerabilities, children with disabilities, children that are outside of the family care, migrants. The way we tend to think about margins is really in a more broader way. What are the contextual factors or the conditions within which children live that really put them at the end of the kind of developmental trajectory because they're not able to receive the sufficient support that they need in order to develop optimally. So I'm going to talk about a few, kind of slice the data in a few different ways and talk about factors that I think this group is quite familiar with, but it's really interesting to see them coming over and over from our data globally. So this is a slide from Ethiopia looking at skill variation, in this particular slide literacy, but this slide very much kind of represents what we see across other domains by socioeconomic status. And what we see, of course, is that children in the lowest quintile from the poorest families are at quite a bit of disadvantage compared to their peers in the highest quintile of socioeconomic status. So this idea of poverty and extreme poverty that is really affecting the developmental outcomes of kids, we're seeing this over and over, and I think it's an important story to keep bringing up to national governments as well as globally. Here's another factor or another margin, the urban or kind of the location where kids live, the urban versus rural. Again, without a doubt, in every context where we have this kind of data and we have a population sample that has both urban and rural, we see that urban kids are at a higher advantage in terms of developmental outcomes compared to their rural counterparts. Here's maternal literacy, which again, it's to this group. This is no surprise that kids who have literate mothers are at an advantage in terms of developmental outcomes compared to kids with illiterate mothers. And again, this is Mali, but we see this in other countries as well. Here's gender, and I will mention that gender, for the most part, doesn't appear across the 25 countries where we've looked at this data. There's 2 countries where this is pronounced as a kind of a trend in terms of inequity. Pakistan and Afghanistan is the second country, but for the most part, we actually don't see these gaps. However, in countries where this is an issue, I hope you can start thinking about the policy implications of this kind of data. These are 5-year-olds about to enter grade 1 next year. If these are the inequities that we see at the age of 5, imagine what happens to that gap by grade 2, 3, and 4. And here's one that we love exploring at Save the Children. It's the home learning environment. And it's really looking, again, I think it's linked to Holly's slide before, the engagement of parents and the support kids get at home in terms of learning and development. This is really just a graph of the number of activities anybody does with the child over a period of a week. And you can see what a difference it makes. If a child is receiving a lot of support and a lot of engagement, their score is obviously quite different from kids who have very stressed parents or parents who are not necessarily engaging at that level. Thank you. And what happens if I think that the interesting thing about the margins is that margins can overlap, and all of these factors and contextual kind of characteristics that we're talking about, they're often convergent in a lot of groups. So I want to talk about access to ECD. I'm sure you're not surprised to know that across all settings, this is Bhutan data. Kids who are not who are not receiving ECD services are kind of at a disadvantage in terms of developmental outcomes and school readiness. But what happens if you actually add and converge some of these factors? What you see in the second slide is children who are not receiving ECD services, who are in the low SES quintile, and who also are not receiving home support. And then you see that the gap between the two groups actually doubles. And we see this over and over in terms of converging risk factors and converging vulnerabilities. And I think when we think about margins, I hope globally we can start consider how these factors actually come together to create even more powerful inequities. So I'm going to skip this and talk very quickly about program impact and policy implications, and come back to this. I'll only show 2 slides on this. So here is a slide in Ethiopia, again, looking at the difference between children who are not receiving any ECD program, children in standard kind of ECD provision by the government, and a high-quality ECD program. Going back to the point around quality, I think this kind of data is really informative both to communities and to program implementers like Save the Children, but also to the government to think about what do they gain by additional investment in quality. I think the next one I will show is the different program approaches. This is a slide from Bangladesh, and again, what we can see here is the difference. You're missing a bar on the very first column, but it's really the difference between kids who are not receiving any ECD support, kids who are receiving an intensive 6-week program, which I think our colleague from HF talked about, a very similar program, as an interim kind of solution to a 1-year program, and kids who are in a 1-year program. And it's showing that actually some of these alternative approaches are a fantastic kind of opportunity of investment. So come back to me and at the end, and I'll answer more questions around this. I'll mention quickly that I think that for us, the multi-partner engagement at the national level has been tremendously important to be able to make that data usable and actionable. So engaging relevant ministries, local academic partners, and of course implementing partners in civil society. And I'll just say that in terms of practice and policy and next steps, we're deeply engaged in further equity analysis globally, which I think is really important for this group and for the general global discussion on measurement, exploring effectiveness of different modes of delivery to ECD, which is really, I think, the conversation to access is moving. It's very unlikely that one model is going to be relevant across all the settings, especially in terms of the cost of a more traditional preschool model. So we're exploring different ways to provide ECD support to kids in perhaps more cost-effective ways, but still with strong impact. Looking to expand partnerships and also national level use of the tool. Some countries are already embarking on this. And of course, looking to disseminate a lot of this fantastic data that's coming from the work of Save the Children and partners, and making the tools more easily accessible to a wider group of actors. I think I'll stop there. Thank you.
Thank you, Eva. Eva, thank you.
Okay, so we're going to switch focus again and get back to the 0 to 3 age group. That happens to be my favorite age group, and I think of a lot of other people here. And I'll also be talking about involving families, which is another topic that I'm very passionate about. And this is in the context of using the GMCD, the Guide for Monitoring Child Development, a tool that I've been working with since 2008. So before we get into talking about Guide for Child Development, I just wanted to, these are the organizations that I'm working with on this tool, more about them in a bit. So the first question was, who has access to children below 3 years of age? It's not intuitive in a lot of the countries that we work with, and particularly in India, that, it would be pediatricians or physicians. The picture actually over here is taken right outside my office, and that child and family live in that concrete thing that you see there. And so who has access to this little boy who's going to monitor his child development? It turns out from a study that my colleague Ilgi Ertem, who's the author of the GMCD also, where she looked at 33 different low and middle income countries and looked at who accesses young children, the answer was actually the healthcare system in some form or the other. So it may not be a physician, it may not be, a nurse, but at the very least, it's a community health worker who has access to these children. Primarily because of the need for immunization that these children and acute health care. What are the barriers then in accessing these children for the purposes of monitoring child development? The answers seem to be two. The first was, as many of us pointed out yesterday, care providers have very little training in early childhood development and identifying children with difficulties. I was commenting to somebody yesterday that when I did my residency training 20 years ago, I was completely clueless about early childhood development or child development in general. And that's why I took up this branch, actually. 20 years later, when I'm teaching residents, they're in the same spot that I was in India. And that, to me, is really a tragedy, and hopefully discussions like this and fora like this will change that. The second piece is the fact that Abby spoke about so eloquently this morning, that there aren't any internationally standardized or internationally standardized tools available. So then we started thinking about tools, and when you think about tools, the first thought that comes to your mind is, well, then we need to go out and test children. Any one of us here who has been the mortified parent of a child who didn't do what you wanted them to do in a span of 20 minutes will bear witness to the fact that child testing can be unreliable. Children don't demonstrate particularly functional skills. How do you eat with a spoon? How do you take off your jacket? They don't demonstrate that in a test setting. Also, just think about the last two factors that I've highlighted in this slide, which is, does child testing really catalyze family participation? In a 0 to 3-year-old, you're really looking for families to be engaged and involved in child development, and child testing really doesn't allow you to do that. You're sitting nervously. Any of you who watched your children being testing know that no matter what a star you know that your kid is, you're nervous about the results of that test, and you're not really thinking about how you can contribute to it. Most importantly also, it doesn't identify risk factors in the family. It doesn't tell you if the mother's depressed. It doesn't tell you if there's alcoholism in the family. It doesn't tell you any of those things that we want to know. Additional barriers in low and middle income countries, when you ask yes and no questions, they usually respond with what they think you want to hear. The power equation is clear. Does your child speak in 2-word sentences? Yes. Right? Also, importantly, their literacy levels are low. They can't answer written questionnaires. And their knowledge, and we all know about caregiver knowledge of child development in settings like these, may be skewed because of the developmental delays in the children around them and because of their lack of their own knowledge. Stigmatization is high. You don't really want to talk about your child with delays. So what the Guide for Monitoring Child Development really tries to do is these 5 things. Firstly, reflect the bioecological theory, which all of us have been talking about yesterday, the multiple factors that contribute to early childhood development. Secondly, the key thing in this is the monitoring and support component, which I'm going to talk more about. Holly touched upon that briefly when she spoke about screening versus monitoring. Screening is this. It's a snapshot in time. It tells you how the child is doing at that particular moment. Monitoring is sort of a continuous video recording of how that child's development is doing over time. And this we know is important. It identifies risk factors. It looks at functional outcomes. And I'm going to talk about the evidence base for the GMCD. So the GMCD has a history of 20 years. It was developed starting 1995 by Ilgi Ertem in Turkey. The tool was used extensively in Turkey. The validation studies are done, published in Pediatrics in 2006. I think it's there in our reading material. And the idea behind this tool was to provide an instrument that would enhance developmental monitoring, provide support to families, and manage children who were detected with developmental delays. But the ultimate goal of this tool is to catalyze care provider and caregiver relationships, catalyze that partnership. So the basic principle of the GMCD is that it's a clinical open-ended evaluation, and it's an intervention. It's not a checklist for screening. The key thing is the partnership, and I'll show you what I mean. So when the GMCD begins, you actually ask an open-ended question. Well, explain first what child development is. You talk about, we've been following your child. Say it's a community health worker. She says, we've been talking about your child's health. We've been talking about immunizations, illnesses. Just as it's important to monitor health, we want to monitor how your child is learning, how she's developing language. You know your child the best, and the first 3 years are really important. Will you give me a few minutes to talk about this? The first question in the GMCD is it's the only one that's a closed-ended question. It says, it describes what child development is and then asks if the parent has any concerns about this. Second question onwards, we run through all the developmental domains of expressive language, receptive language, fine motor skills, gross motor skills, play and relationships to look at socio-emotional development and self-help skills. And the questions look like this. Tell me how your child communicates with you. Tell me how Asha, say, communicates with you. How does she let you know when she wants something? What kind of sounds does she use? What kind of words does she use? So you're asking an open-ended question, and the mother gives you an answer. And I have some video clips later if anybody's interested in seeing community health workers administering this tool, where the mothers are answering in long sentences and paragraphs. They're talking about their kids. And the tool takes just 10 to 15 minutes to complete. But this is the first time the mother has had an opportunity to talk about her child's development and know that it's a topic that she can talk to her care provider about. The questions go on until questions 8, 9, and 10. 8, 9, and 10 are the ones that look at psychosocial risk factors. So we begin with question 8, which says, what do you do to support Asha's development? How do you play with her? How do you get her to communicate? Usually by this time, the parent has already given you examples as part of expressive language, as part of play, in terms of what she does with the child. And you could reframe this question in terms of, I have heard so many wonderful things that you do to support Asha's development. Is there anything else you do when you play with her? How do you get her to communicate? So these are the prompts that the health worker gives. And below the prompt is a suggestion for the health worker to support by praising every effort. If needed, give suggestions, look at the card. And I will show you the card in a minute. Encourage the caregiver to try these out in your presence. Praise positive interactions. Question number 9 and 10 actually are related to maternal depression and other risk factors. I'm happy to share those with anyone who wants to look at them later. This is the support component, and it's nothing but an improved version or an added-on version of the WHO UNICEF CCD card, the Care for Child Development card, and except this includes socio-emotional milestone suggestions as well as fine motor. A few words about the international GMCD. The international GMCD is what we're just completing this year. For the last 5 years, we've been working on an RO1 funded by NIH in 3 middle-income and 1 low-income country. We've been working with Turkey, of course, but India, Argentina, and Pretoria in South Africa. It's an ethnically diverse group of children with different cultures and 10 different languages. You can only imagine the logistics of translating and back-translating all of those, and an enrollment of over 20,000 children in 4 countries. The first phase was a standardization, the second phase was establishment of validity, and the third phase, which we are just completing now and analyzing the data, is the implementation phase. We wanted to look at the challenges to implementation. I do have to mention here, which I'll mention again, that we used children without any known health risk factors. So in other words, we used a prescriptive population of children. These were children who were not low birth weight, not malnourished, not anemic, and didn't have chronic illnesses or known developmental disabilities. So these were our exclusion criteria, and these were the children we looked at. I'd love to share this data with anybody who's interested, but suffice it to say we ended up excluding almost 50% of the sample, which shouldn't come as a surprise to most of this audience. These are the partnering universities. On the extreme left is Ankara University, extreme right, Yale University where the 2 PIs were from. And the research question we really wanted to answer is development in healthy children similar in different countries? And can these similarities be used to develop an open access international GMCD that does not require re-standardization? What we really wanted from a policy perspective was to cut through the eternal cycle of revalidation again and again of every single tool in every single country to see if we could find milestones that would cut across at least 4 countries. And here are some of the answers we got. This graph is similar to what Abby had when she was showing her graph. The points actually are points that do not represent single children, but the percentage of children who achieve the milestone at that age. And this particular one is an expressive language milestone. It uses index finger to point. And you can see the 4 countries are 4 different colors, and there was beautiful overlap between them. And we were fortunately looking at the 0 to 3 age group, and we could certainly see that in the majority of the milestones we looked at, actually. Here's play, actually. This is simple imaginary play. Like putting a doll to bed or feeding the baby. And you can see again the overlap between the 4 countries here. And here's where they diverged dramatically, not surprisingly, where there were cultural considerations in how children use their adaptive skills, how they use their self-help skills. So items like wearing clothes, drinking from a cup, those were the ones that diverged majorly. So the conclusions of the International GMCD study was that most developmental milestones in the 0 to 42-month age range were attained at similar age ranges by both genders in different countries by children without known health risks. We are just actually analyzing the data on our excluded sample, and the results are fascinating, and they're certainly different. The GMCD has been, we hope, developed as a unique, comprehensive method that we can offer internationally as an open access tool. I'm commenting on practice. So I can speak personally about how we've used this in our early childhood development and disability program since 2008. Not the international version, because that is only now just ready, but the version that was the original Turkish version. It has been a delight to have a structured way of teaching a family-centered approach to community health workers who have never had anyone use a strengths-based or family-based approach with them. And if I show you the video clips, you'll see what I mean. They have really internalized what it means to use a strengths-based approach and to support families in supporting their child's development. And there is that cascade effect. The way we teach them and their supervisors is how they work with families, and that's how, in turn, they work with their children. And so it's really important to use that. We've also done this training at several levels, not just community health workers, because we had the strange situation of having community health workers identify children with delays and then have them refer the child to a pediatrician who then said, I don't really see anything wrong with this child. So we've done training at the top as well with pediatricians, physicians in neighboring countries, in Bangladesh and Nepal. These are all the countries that the GMCD training has been done in. Bettina can speak more to you about what has happened in this region with partnership with the UNICEF. In summary, over 25 countries is where the GMCD is currently being used. From a policy perspective, certainly in some countries in this region, and particularly in Turkey, it's part of the Health Ministry's recommendations for monitoring children. We are working on an app that looks at using this that will ease the implementation of the use of the tool. And the dissemination is really our major plan for the next few years, which we begin at the international conference, DBP conference in Istanbul this year. Thank you.
We're getting some very rich examples of the use of measures like this by families, by practitioners, and policies, so thank you very much. Are we ready to go to the video by Ruth Peru?
Atlanta, Georgia.
It's a PowerPoint with sound, so...
To be there in person. I want to thank the forum for the CDC's Violence Against Children surveys. Before I continue, I would like to thank my colleagues, Dr. Jim Mercy and Dr. Susan Hillis, from the Division of Violence Prevention at the CDC who are leading this effort. I'm going to talk about the Violence Against Children surveys, using data to drive action, partnerships, and Thrives, a global technical package to prevent violence against children. Violence against children is costly and destructive. It is estimated that more than 1 billion children, half of all the children in the world, are victims of violence every year. Children who experience violence are at greater risk for common and destructive yet preventable consequences. Sexual violence against children erodes the strong foundation that children require for leading healthy and productive lives. Globally, studies show that exposure to violence during childhood can increase vulnerability to a broad range of mental and physical health problems, ranging from depression and unwanted pregnancy to cardiovascular disease, diabetes, and sexually transmitted diseases, including HIV. Despite this, in many countries, the extent of sexual violence against children is unknown. Estimates are needed to stimulate prevention and response efforts and to monitor progress. VAX is part of the Together for Girls partnership, which focuses on conducting national surveys to document the magnitude and impact of sexual violence, supporting a coordinated response to strengthening violence prevention, and leading global advocacy to promote evidence-based solutions. The VAX are implemented as part of a broad public-private partnership, which has expanded this past year with the additions of USAID, WHO, and the Canadian Agency for International Development. In 2015, CDC will be working on VAX implementation and response in 16 countries, shown here as completed and in progress, where they are being used to drive effective, sustainable, and scalable action to reduce violence. Currently, demand for expansion of CDC technical assistance for implementing the VAX is high, particularly in Central and South America and in Asia. We are pleased that we have begun to work with China and Colombia on a VAX, as both are influential countries with high potential for leadership in their respective regions. Additionally, the World Bank and USAID have recently initiated a dialogue about implementing VAX in several new countries under consideration. These countries include those three: Guatemala, Honduras, and El Salvador, most implicated in the 2014 unaccompanied children's crisis, during which thousands of children fleeing violence in their homes and Violence against children surveys are nationally representative household surveys of children and young adults aged 13 to 24 years. VAX are administered by host country survey workers trained by CDC and local partners via household face-to-face interviews. Surveys are initiated at the request of host country governments. And survey topics include background information such as demographics and education, gender attitudes, safety, witnessing violence, violence victimization, including sexual violence, violence perpetration, health risk behaviors, health outcomes, and service seeking and utilization. Now I will present some of the latest data from VAX. This slide shows the prevalence of sexual violence prior to age 18 reported by females and males 18 to 24 years of age in 8 VAX country sites. For girls, in pink, the range is from 4% to nearly 40%. For boys, sexual violence ranges from 6 to 21%. Data such as these on the prevalence of childhood sexual violence showed us how urgently we needed a robust technical package. This slide shows the prevalence of physical violence prior to age 18 reported by females and males 18 to 24 years of age by parents, adult caregivers, and authority figures in 7 VAX country sites. For girls in pink, the range is from 42% to 66%. For boys, physical violence ranges from 52% to 75%. This slide shows the association between childhood sexual violence and selected health conditions. Females 13 to 24 years of age in Swaziland. As mentioned earlier, exposure to violence during childhood can increase vulnerability to a broad range of mental and physical health problems. Here we see increased risk of negative health conditions and behavior associated with exposure to childhood sexual violence. This slide shows disclosure and service usage by 18 to 24-year-old victims of sexual violence prior to age 18. Most persons who reported experiencing sexual violence during childhood did not receive services for their abuse. It appeared that few children even seek services, possibly because they are not aware of service availability, services may not be readily available, or stigma may exist. But the take-home message is that clinic-based services are woefully inadequate, and we need community-based interventions and services. Findings from VACS provide data that may help countries ensure that limited resources to develop, launch, and evaluate violence prevention programs and child protection systems are used most effectively. As part of the arrangements to execute VACS, host countries develop response plans based on survey findings. Country-level responses have included legislation, school-based education curriculum, media outreach, service provision strategies, and an increase in the workforce capacity of clinicians, police, social workers, and teachers, among others. Thus, beyond simply disseminating information, VACS have a built-in mechanism intended to raise awareness, catalyze action, and effect change. In the next two slides, I will spotlight a couple of efforts from participating countries. This slide shows the African Child Friendliness Index rankings in 2013 and 2008, where you see an increase from Swaziland going from 45th to number 9. As reported by the African Child Policy Forum, Swaziland's improvement in the African Child Friendliness Index was due to a substantial reduction in infant mortality, and also because they have put in place national laws and policies to protect children from violence and maltreatment. And they have allocated adequate budgets for sectors targeting children, while ensuring that those allocations are translated into better child well-being outcomes. This slide shows the VACS Nigeria coverage in September 2015. So just this past September, Nigeria received a great deal of media coverage on the release of the VACS finding. With some media outlet reaching over 60 million people within the country. And the UN Secretary General commended Nigeria for being the first country in West Africa to complete the survey on violence against children. On the CDC website, there are links to reports. Given the data and the need, there was a need for a technical package that can help countries in identifying programs and policies that are effective in preventing and responding to violence against children. In conclusion, we hope to continue to collaborate with global partners to contribute to changing the paradigm for children, moving from a vision of surviving to a vision of surviving and thriving. And we see the work of this forum and our participation in it as a critical component of Thank you. And on this slide, I have some information on how to reach CDC and get more information overall on CDC and links to VACS and Thrive.
Great. Well, a really rich set of presentations. We're going to take a break until 11 o'clock, and then we'll hear from Emily Vargas-Perón for some comments and about half an hour of Q&A, which is great. Right.